So, hey everyone. My name is Alexis Obina, and this is the Foster Friendly Healthcare Concrete Approaches to Delivering Sexual Health Care to Youth in Foster Care. Is there a specific prompt you want to go off of, Erica, or do you want to introduce yourself first?
Well, let's see if I can make this thing advance. Here we go. Okay, so there's a couple things we just wanted to run through before we start. First of all, just that this session is really focused on providing care for youth who've experienced trauma, including abuse, neglect, and sexual assault. So there are youth quotes and voice that may relate to these topics. There may be content or experiences that may be triggering to some people who are attending. So just take care of yourselves. And do note that some of these topics relate to experiences of exclusion, including racism.
Yeah, and we just also want to note the language, and all people deserve comprehensive reproductive and sexual health education and care, no matter their sexual orientation or gender identity. And we strive to use neutral language in this presentation. In a few places, we use the term woman to conform with cited research or data. And then, yeah, hey everyone. Again, I'm Alexis Obina. I do a lot of advocacy. I do a lot of independent contracting work with different nonprofits specializing in outreach, engagement, and also just making sure that foster heard. I also do some educational advocacy, and I'm a board member on the Youth Advisory Committee board for RHEP. And so it's been really an amazing journey to be on RHEP for a while now and just be able to spread awareness and advocacy for sexual and reproductive health rights. And I'll pass it to Erica.
And hi, I'm Erica Monasterio. I am now retired. I was a clinical professor at UCSF and am a family nurse practitioner who has worked with youth and young adults for the last, like 40 years or so. I've been working as a consultant with the National Center for Youth Law and RHEP with the National Center for Youth Law for, I don't know, 15 or 20 years, and with RHEP for the last 5 or 10, in developing materials, programming, trainings focused on healthcare providers working with young people in general and youth in foster care specifically for about the last 3 to 4 years.
All right, so we're going to get into the background of the toolkit. Next slide, please. And in the toolkit, there was a promoting healthy sexual development as part of the American Academy of Pediatrics guidelines for health supervision of infants, children, and adolescents. And they advise healthcare professionals to integrate sexuality education and care into their relationships with adolescents and pre-adolescents. And yet, when RHEP surveyed youth in foster care in Los Angeles County and asked how many had received information related to sexual and reproductive health from their healthcare provider, only 16% of 12 to 13-year-olds said yes, and only 19.5% of 14 to 16-year-olds said yes. And so we need to do better. And our message to health providers is to listen to young people and to allow them to be decision makers in their health and health education. I'll never forget when I exited Medi-Cal and now have my own insurance company. My new insurance company asked me what my goals were in my life, and creative supportive services, educational information, and resources to support my sexual and just general health. And Medi-Cal providers always kind of told me what to do and what I needed and kind of forced things onto me that I felt that I didn't need. So having an opportunity to make my own decision and my own choices in my health really allowed me to make smarter and more informed health decisions. Next slide, please. And so just looking at the lack of quality care is leading to disproportionately poor sexual and reproductive health outcomes. And as an advisory board member, there are many barriers that I've heard each of us kind of facing when it came to sexual and reproductive health. It could have been transportation, it could have been just not just being able to for being maybe in congregate care or just not even being able to go out or just not having access to a center that could support them. And I found that also one of the biggest barriers is also just bias. And in California, youth transitions to adulthood study, almost 50% of females in foster care in California reported having been pregnant at least by age 19. And so there is already maybe a negative bias in people's mind. And then we also see the percentage where almost 70% of the young people said that their pregnancy was not intentional. And we have to remember that it's not always their fault. There could be different things that lead up to unintentional pregnancy, including sexual abuse, unfortunately. And so, yet only about 30% were using contraception at the time of conception. And so, those are some pretty hefty percentages to think about. Next slide, please. And so here are some percentages involving vulnerable populations, including young people with mental health conditions, Blacks and African American young people in care, and LGBTQ young folks. And an example is 23% of youth in care nationally identify as Black compared to just 14% of the general population. So it's a huge disproportion. And it is also important to acknowledge that these disproportionately poor outcomes are impacting young people who are too often already part of groups that have already faced intersectional and systematic barriers to qualify for health care, which leads to disproportionately poor outcomes. And so knowing your rights, self-advocacy, and knowing what you have access to can help bridge these gaps in the healthcare system. There are many times when I've had health professionals tell me that I didn't look like I was in actual pain, or just kind of imply that I wasn't telling the truth, or maybe I was there for a different reason. And so that self advocacy was very important to me, and making sure that I express my right to have that quality healthcare, regardless of my race or ethnicity or their bias. And so, next slide, please. Just looking at this, just making sure to accept the goal of this toolkit. We must recognize and accept that poor health outcomes are not the failing of the young people, but rather a failing of complex, intertwined systems that don't allow us to put young people first. I had a doctor, he was pretty cool. He would always like prescribe me like skin medication or things that I needed. And I was like, oh, that's cool. But he got shut down for medical fraud and went to jail. And so like I remember my last visit there, I literally was there for 3 hours for some reason. And like I started getting like very impatient. And so I was like kind of being annoying. And then I looked at my file and I saw these things like ultrasounds for my heart because I had a heart murmur and like EKGs that never happened. And like they were just billing Medi-Cal and didn't really, I felt like, see me as a person. They just kind of saw me as, I guess, a check. And it did come back on them, but it makes me think of how many other facilities, can perpetuate just this thought of their people that they're supposed to be protecting as just customers and money versus people who have real lives and real needs and need information to make smart decisions for their self. And so, next slide, please. The poor health outcomes referenced earlier are not primarily about an individual. A person's health is impacted positively or negatively by a number of factors, including biological, which could be genetic factors, environmental and socioeconomic factors. Environmental and socioeconomic factors are often referred to as social determinants of health. And so the condition in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. And so, some examples of social determinants of health include housing conditions, poverty, educational opportunities, literacy skills, and critically like racism and discrimination. And so youth in foster care are more likely to face social determinants that negatively impact health opportunities, often on multiple fronts. And so we'll look into that in the next slide. That talks about the importance to acknowledge that many social determinants and barriers to sexual and reproductive health access are outside the purview of the healthcare system itself, such as economic stability. And although health providers don't have fixed or fully mixed context youth are coming from, it is critical to have that care provision, and healthcare providers can play a central role in changing the sexual and reproductive healthcare experiences of youth for the better, both through the services that they provide and the information that they share. Next slide, please. So here are some quotes from the advisory committee meetings and a study from youth in our out of home of our out of excuse me, the study from youth in and out of care and in the RHEP advisory board about experiences in foster care. So as you can see here, personally, I did not have a regular clinic. I moved around too many times, over 16 locations, just in high school. And each time I moved, it was a different clinic. And there has been many times where I felt that my doctor had certain stereotypes about me because I'm in foster care. I had to ask to make me an appointment because the group home knew where we were supposed to be all at all times and controlled all the transportation. And a lot of times my doctor will say that I needed to do something, but then doesn't offer me any support in figuring out how that thing could get done. So that's just some things to think about. Next slide, please. And so through our shared experiences, our goal was to make a toolkit developed by providers and young people that can break down various topics that can feel overwhelming to make a difference. And so healthcare providers can play a central role in changing the sexual and reproductive healthcare experiences of our youth for the better. Through the services that they provide, the information that we share, and the spaces that we create, the REP toolkit can help us get there, can help get us there. And so the toolkit provides a process for how providers can change the practices and cultures in their clinics. And so I'll pass it to Erica to kind of explain more.
Great, thanks, Alexis. So, excuse me. We're going to be talking for the bulk of the rest of this presentation about the toolkit. We want to share some of the content and also just pique your interest and hopefully get you motivated to take a look at what we've created and how it can help you to provide appropriate, adequate, friendly, accessible care to young people and young people in foster care. So the toolkit development process was a very much an iterative process. It's actually taken us a number of years. We started out by writing subject area experts, writing sections of the toolkit, looking through the research, trying to put it together best practices. We worked very closely with the youth advisory board members, giving them materials to read, getting feedback from them, expanding and contracting what we were going to be writing about. We also had a group of provider experts who were working in clinics where they saw young people who were in foster care. So looking at both their advice about what works and didn't work, what tools would be most helpful for them, structurally how the toolkit should function and look. A lot of encouragement to come up with one-pagers and short, clear directions, but also an opportunity to take a deeper dive. Once we had spent, I think it was probably about 2 years developing content, we then started working with a group, designer group, who really helped us think about how to present the material. and how it would be most accessible to our target audience. But this, as you can see, it's been a cycle of review and incorporating feedback, revising the content, reviewing again. And that process will continue, and I'll show you at the end how you can have input into what's in here and what's accessible from here. So I'm going to give you just a quick overview of the toolkit, and you'll see many slides that are jam-packed with information because they're screenshots from the toolkit itself. That's not so that you can read the information, but so that you can know what's in there and hopefully go back and look later at the information that is on some of these slides. So the toolkit is organized around guiding principles, and we will review those right after I give you an idea of how it's organized. But we have guiding principles, the explanation and rationale for them. We then have study modules, which give you an opportunity to take a deeper dive into different areas of concern that are pertinent to the care of youth in foster care and to the provision of sexual and reproductive health care. And then we have practice tools, which are concrete tools, advice, handouts that you can use in your work providing sexual and reproductive health care. This is actually a page from the toolkit that shows a pathway to change. And we've thought about change in terms of the individual actions that any provider can take to educate themselves and to implement better practices between them and their clients in the exam room. But we also want to encourage systems to take action as a team to champion change in the clinic so that it's a friendly, inviting, functional place for young people to go and get their care. We also want to encourage clinics to track and progress their actions, that this isn't a process of just changing something and then saying, okay, we're good and moving on, but really engaging with young people who are receiving services to hear what they think about the services, what they would like to see, how they'd like to have things change, and what their role can be in the provision of services. And then finally, sharing feedback and stories. We are developing a resource hub that anyone who's using the toolkit can contribute to so that we stay up to date and are aware of all the best practices as they develop. So this is a sheet that shows some actions that you can take as an individual care provider, and that might be as a clinician, a social worker, an advocate, a navigator. All of those people are care providers in this context. So again, change can start with the individual. And on these pages in the PDF, I'll show you at the end, but these things with the little circles are all actually links so that you can go directly to that area of the toolkit. So there's some advice and suggestions and resources for those looking for changing their individual practice. But also in approaches to taking action as a team. So looking for system-wide changes, and you can see we have action steps and links to tools here, as well as you can see over here in this where there's blue highlighted, these are links out. So they're both links in and links out. And what we really want to encourage folks who are engaged in providing care for youth in foster care is to really think of themselves as part of an ecosystem of care. To know what their role is in that ecosystem and who are the other players, and your best informants are always the young people that you're serving, because they may have people in their ecosystem that you would never, or people or programs that you would not think of right off the bat. But we also really want to encourage programs and services to look at their programs and services, to not do things the way they do them because that's the way they've always been doing them, but to really take a look at and think about what are the needs of their clients rather than what are the needs of their system, and how they can best meet those needs. This is a collaborative, inclusive, and cyclic process. So tracking and progressing actions is really an important part of this. And you can see Alexis will pick back up towards the end of the presentation to talk about youth voice and how to engage with the young people who might access your services, might be eligible for your services, might have used your services in the past, to make sure that what you're doing and the way you're doing it really meets their needs. So let's look at some of the guiding principles. These are our three main guiding principles: to engage in shared decision-making with youth, to respect and accommodate individual needs and preferences, and to center the impact of and response to and recovery from trauma. So engaging in shared decision-making is a process of collaborating with young people to incorporate healthy choices and healthy behaviors. Our role as care providers or service providers is to make sure that we're providing options, supporting autonomy, and encouraging and facilitating and supporting agency on the part of the young person. Making sure that they have options and adequate time, space, and support to really understand and think about and choose what's right for them. Remember that youth are the experts in their own lives, and they really want the opportunity, deserve the opportunity, and need the opportunity to hear balanced perspectives on sex and their bodies, learn without fear, and make the right decisions for themselves. So being client-centered, strengths-based, and culturally humble are characteristics of a provider who can work well with youth in care. And these are some quotes, one from a young person, one from a provider. The provider may be an expert in clinical care, but the youth is the expert in their own life. Only the youth can determine what care best accommodates their particular health concerns, beliefs, needs, relationships, and lifestyle. And the provider says, I usually will discuss with the patient every single type, this provider is talking about contraceptive choices and why it might be good for them, why it might not be good for them. But I like to make it an open conversation because I don't know their lives and I don't know what's going to be easier for them. So again, this idea that the provider is not the expert in everything and really the choice is in the hands of the youth. So our second guiding principle is to respect and accommodate individual needs and preferences. This takes time. You need to get to know the youth and their priorities. You need to build trust, and building trust takes time, particularly for young people who have had trust really betrayed on many levels in many aspects of their lives. So getting to know them is important, and also giving them a chance to get to know you. Remember that the most important concern that you can address is the concern that the patient brings to the visit. Even though you might have a laundry list of things that you as a provider think you need to address, they are really secondary to the youth's priorities. To respect and accommodate individual needs and preferences, the provider needs to be anti-racist, provide developmentally appropriate services, be aware of the neurodiversity of their population and be disability inclusive, and be inclusive of sexual and gender minority youth. So again, some quotes that pertain. I've had a couple of doctors and I always see if their energy is good. And depending on that, I might open up. If you don't approach me right, or I feel like I'm not welcome, I won't feel comfortable. I've had so many doctors rush and I feel like I'm trying to tell them what is going on, but they just rush me out. I can't tell you how many times in this process, particularly working with the advisory board, that we would hear young people tell us, I feel like the provider's just going through a checklist. Like they talk about confidentiality, they're just going check, 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 and not really talking to me, listening to me, or answering my questions. And finally, a very essential and central to this process is to center the impact of, response to, and recovery from trauma. We need to be trauma responsive and healing centered because by definition, our population, youth who are in care or have been in care, have experienced trauma. You need to be able to really be trauma responsive and healing centered, help the young person to refocus from past trauma to future goals and aspirations, support them in regaining a sense of holistic well-being, and enhance their agency and autonomy. So being trauma responsive, healing centered, and confidentiality conscious are important aspects of this guiding principle. When I went to the doctor asked me if I had ever had sex. I didn't know how to answer. I went into foster care at 6 years old and had an STI then. Does that count? I try not to tell people that because I feel like they judge me and think I'm dirty or something, but I was just a kid. So this is just such a poignant quote that really brings home to us how when you go on automatic pilot and you're going down your checklist and you're reading your questions off your form and you say, age, how old were you the first time you had sex? You're not being very sensitive to the person sitting in front of you. You're not thinking about what their lived experience might be. And so think about framing your questions and getting to know your client before you dive into your health history. So we have included in the toolkit study modules, and the study modules are really so that you can take a deeper dive. These are the study modules that are included. There's one on foster care to understand the system and the unique circumstances youth in foster care must navigate. And this one is California specific because foster care rules and regulations and laws are state and county specific. The next section is confidentiality and consent laws to ensure that youth's rights are honored. And again, because the law is state specific related to confidentiality and consent, this is a California specific section. Now the approaches around explaining, etc., and considerations of systems that impact on youth in foster care are not, are pretty universal, but the law itself and the foster care system itself in this toolkit relate to California. Then there is a study section on trauma responsive and healing centered care to help you to create a safe, empowering space and interactions. And then finally, there is a study section on sexual and reproductive health that to support healthy development of youth and in their individual lives and communities. So in these study sections, there's a lot of information, there's a lot of links, it pulls on the research, and this is really for the deeper dive. But you might find that you feel like you really have studied a lot, know a lot, have been working in the foster care system, understand that, then you may not want to look at that section, but you're not clear about some aspect of confidentiality and consent, that might be a section to look at. Or you've heard about trauma responsive and healing centered care, but you don't really know what that is, where, in terms of implementation. Or you have been doing a lot of general health care, but haven't been working with young people around sexual and reproductive health and want to know more about contraceptive choices, approaches to pregnancy counseling, resources, etc. So each of these sections have a lot of meat in them, shall we say. And then the final section well, not the final section, but the other area includes practice tools. And again, these practice tools are in these different areas and are linked to these different areas. So they're practice tools in understanding and interacting with the foster care system, in the application of confidentiality and consent laws, in the application of trauma responsive and healing centered care, and guidance around sexual and reproductive health care specifics. So at the beginning of each chapter identifies the path to follow if you're focusing on system change or on individual practice change. So this is, again, a page out of the toolkit. And this one is from the sexual and reproductive health section. And you can see that there are tools for clinic champion teams, for providers and youth. And then each of these links you can click on to get to practice challenges, practice change opportunities, an ecosystem of allies. So we also wanted to remind you that healthcare system changes, it's a Venn diagram. There is systems change takes a lot of different aspects of the system. So we're encouraging you as a champion for change in your care site to think about training in terms of your own and your coworkers and colleagues training in these different areas of foster care, consent and confidentiality, sexual and reproductive health care, and trauma-informed or responsive care. So do you have adequate training? What is your current practice and where would you like your practice to be? Which would mean that you need to know about innovative strategies, try them out, see how they work, develop policies so that if there's a change in staff, in providers, that there are, that the way that the clinic provides services is going to stay the same because you've developed policies for that. To look at your environment, is it a friendly accessible environment for young people, and that you need all of these components in order to engage in system change. So these practice challenges are key themes and barriers that arose from our advisory board, both the youth advisory board and the expert provider board. And so you can see that there are aspects that are these focus really on particular challenges for youth who are in foster care. And then you can also look at practice opportunities. So these link directly to those practice challenges. So I'll just bounce back for a second. Inflexible and unpredictable schedules for youth in care. So having shifting policies to reduce the need for return visits for sexual and reproductive health care, doing more follow-up on the phone or through texting, because these return visits are often missed due to unpredictable schedules. So, you know, some things that you can do so that people don't miss their follow-up and are able to get the care that they need. And then looking at the ecosystem of allies in the clinic, we also have it in foster care, et cetera. You know, so this is for you as a team to really look at who are the people that you need to engage with, what are the programs, what's it going to take to actually make system-wide changes happen. Because one person working away in their exam room can have a great impact on those individuals that they interact with if they keep coming to your services because the rest of the services are friendly or accessible enough for them to. But when you're gone, nothing remains. Whereas if you engage with your allies and engage in system-wide change, you create a system that is going to be much more accessible, appropriate, and usable for youth in foster care. The last section of the toolkit is bringing it all together, and these pages bring recommendations together and allow you to really check your physical environment and systems. So there are recommendations about website and promotional materials, appointment systems and appointment reminders. So these take into account both what works, you know, young people tell us work better for them, concerns about confidentiality and automated reminder phone calls, et cetera, ability to opt out from those kinds of automated systems if confidentiality is of great concern to your client, being able to come in for a drop-in appointment if there's something pressing and the youth is not able to make an appointment or has missed an appointment that they had made because they weren't able to get there or something else came up. Some tips and suggestions about your waiting room. So that how can you create a space that is comfortable and inviting and friendly? So recommendations about getting input from young people, making sure you have appropriate reading materials, health education materials, that you have Wi-Fi and that people know how to hook into it. So posting the password, having posters that are reflective of your population, privacy barriers. So you can see it gets quite specific in terms of the recommendations, and it's an opportunity for you to look at your own site, see how it matches up with some of the recommendations and think about some changes that can be made. Changes in the exam room so that the exam room is actually private and feels safe and provides for a feeling of protection and privacy for the client, because it's a very vulnerable space to be in when you're talking with your healthcare provider, when you need to remove some of your clothes, when you're being, as my clients say, poked and prodded. You know, it's a very vulnerable position, and you really want to think about what you can do in the exam room to make it kind of even the playing field, promote youth agency, and make it a place where a young person can feel comfortable. And looking at your follow-up systems, again, to make sure that they don't interfere with confidentiality and that they make it possible to really encourage follow-up that meets the needs of your clients. Sometimes we have systems that rely on a person coming back for a follow-up appointment, and that's how we track them and make sure that they're getting what they need. But particularly in the population of youth in foster care who go through so many, especially for adolescents, go through so many changes in placements and resources and transportation and school, relying on them coming back is not a good way of making sure they're getting the follow-up they need. So really thinking about other kinds of approaches and systems to assure that you're facilitating follow-up. Like one of the quotes that Alexis read at the beginning, a young person saying, my doctor would make all these suggestions and recommendations, but then not really give me the tools or help me to figure out how I could follow them. And thinking about continuity of care, again, remembering that this takes time and provider consistency, that relationships are important, and it can't just be the provider du jour that takes responsibility for a client, that we really need to honor those relationships and know that we're an important piece of the puzzle too. So we also have sheets like this one on practice change opportunities for individual providers. And going back to those barriers, the practice barriers that were on the page, a couple pages back, I'm looking at what you as an individual can do. So that, missed appointment doesn't mean missed contraception and an unintended pregnancy. So that you provide universal education and guidance around sexuality, healthy relationships, and sexual health, because a lot of youth in foster care may not get that material at school. In California, we rely on people getting their sexuality education at school. But if you're not there, or you just changed schools, or you didn't get that class, or, there's so many transitions that interfere with young people getting that information. So there's lots of practical tools for sexual and reproductive health practice. This is just a list of some of the actual one-pagers that are provided in the toolkit, and you can see they really cover a wide range of topics. Sometimes the information is integrated into guidance, and also there'll be a link on the page for if you want more information or to take a deeper dive on a certain aspect or topic, or a resource that's been done beautifully by another group and we certainly don't need to duplicate it, then that link will be in the toolkit and you can just click on it and be taken to it. So this is an example of one of the study modules, talking with one of the tip sheets in the study module on sexual and reproductive health. This one is talking with youth about sexual health, and there are conversation openers, reframing of questions and support cues, some advice for kind of do's and don'ts. We try to not do a lot of don'ts, but there are some don'ts here too. So trying to just help you to think about how you might reframe your approaches. Here's one on trauma-sensitive approaches to the physical exam. And again, thinking about the trauma experience that so many youth in foster care have had, and how we can make our interactions with them, first to try to make the interaction itself not traumatic, but also to try and keep the interaction from being triggering. But if it is triggering, that we know how to respond. Again, another example, shared decision-making approach to contraceptive counseling. So, not that the provider walks in and says, here's what I want you to take, but that the provider walks in and says, what do you know? What do you want to know? What have you tried? What have you thought about? What do your friends use? What are you interested in? And then really focusing their informational interventions around the things that are priorities to the client. And you can see again on here, many of you are probably familiar with Bedsider. There are the My Birth Control decision-making tools. There's a lot of great interactive tools. We're not trying to replicate them. We just want you to access them. And then we have put some tools like this that you'll probably recognize this. This is from Bedsider. This is a birth control effectiveness chart. There's a QR code there that the youth can use, or the provider can use, to bring it up on their phone if they want to look at it later or engage in the interactive aspects of it. There's also guidance around providing inclusive services. So just reminding people that it's not only cisgender heterosexual females that get pregnant, that anyone with a uterus and ovaries, even if they're taking testosterone, can get pregnant if they have vaginal sex. And this is something that you need to discuss with all your clients who have any potential risk for pregnancy. And so this is a great handout that is linked here of birth control across the gender spectrum with advice, for example, of contraceptive choices and their interaction with testosterone if the client is taking testosterone. Here is another example of a section. So this is the trauma responsive and healing centered care section. And again, they're all kind of designed the same way. So it's a familiar approach, but the links are to different resources, that are appropriate to the topic. And again, when you're using the toolkit, you might say, oh, I really need to look, I know a whole lot about trauma, but I'd love to see what these keys for reducing re-traumatization are. You can click here and it'll take you right to that page. So some of the tools for trauma sensitive care and response are listed here. And again, we really want to encourage you to take a look at them. There are some very concrete suggestions for how to reduce re-traumatization and respond to trauma symptoms, and how to support young people when they do get triggered and are feeling really uncomfortable in the environment. So here are the guideposts for the clinic. And they probably are very familiar to you all who are familiar with trauma-informed care. And then here's a very concrete approach. This is the finger hold practice. It's a stress management strategy. It's good for youth. It's good for providers. It's good for us in all sorts of environments. So this is something, again, there's a QR code. The youth can download or just pull up the exercise on their phone. And so can the provider if they're in the exam room and want to share it. So I'm going to pass this back to Alexis.
Thanks, Erica. So,
oops, I should probably go to the next one. Sorry.
No worries. Thank you. So, give me 1 second. I'm having an issue pulling up my notes. But the youth feedback can be used to establish baselines, set goals, and measure progress. And there are different ways to engage youth. So here are some suggestions. Thank you. And so at most basic, it can be a youth survey or a youth questionnaire. It could be online or in person. It could be qualitative or quantitative. And it can screen on some of the key issues flagged in this toolkit. So if you want an example, one that we suggest is from the Adolescent Health Initiative. And then we'll share the link to them. And then there's also patient satisfaction surveys. And this is about what the patient expected versus what they received. The only problem with these is that many youth in foster care have pretty low expectations already. So after so many bad experiences, it's kind of hard to kind of have that faith or get positive results only because just anything above horrible is like a great experience for us. And so good results may not mean that you're truly setting the highest standard or the highest board, but at least we can kind of gauge what things are working for young people and what things may not be working for young people. And so another idea is a youth task force, and that is a time limited group that comes together to meet a specific goal. Maybe they can meet over 4 meetings or 5 meetings or a year, however long it needs to be, to provide feedback on key parts of maybe your clinic or a specific provider. And it could be either targeted or overall. So maybe some targeted feedback sessions would be about like your website, your waiting room, maybe some resources that you provide. And then they can also provide specific recommendations and then you as a provider have to act on them. And youth advisory boards is another idea that preferably I really enjoy being a part of a youth advisory board. And I think that they're extremely beneficial because I think having those long-standing relationships again builds trust and then allows people to kind of be more in depth and give more clear, concise feedback and allow more time for very targeted, very specific needs and recommendations. And so it doesn't just have to be limited to the ideas that or the tools that we've said today. And if you want to share any, please feel free to drop it in the chat or maybe something that your clinic or your provider is using that is working. Please let us know. So hopefully we can incorporate that as well. And then moving into the next slide, um, you want to capture youth feedback to be able to set your goals and to plan for change. So we call this setting a baseline. And the key then is to set concrete goals and a plan for how to implement them. And is it about your website, your physical layout, about the practice skill of your staff? It could really, again, just be anything. And then you want to get set up in a way to continue to test your progress. And then we want you to think about how to share out your learnings and how to really take into consideration those recommendations. And a lot of times people will set small goals, go through this process, and then you can repeat the cycle. And maybe starting small is like the goal. It doesn't have to be tackling a huge like a problem or a huge need in the community. It could be small and work its way up to something great. Next slide, please. And then some more quotes from the advisory committee and a study from Youth In and Out of Care again would be, I really like this idea of continuous care to be able to come back to one doctor if I felt comfortable with them. That sounds like a really great concept. And there have been many times where I felt that my doctor had certain stereotypes about me because I was in foster care. And it is important that everyone the youth comes in contact with is professional from the receptionist on up. And then I'll pass it back to Erica to talk some more about the learning and sharing.
So what we're hoping, I don't know if you noticed a couple of, I'll go back. See this little blue thing that has youth feedback examples. So these are Google Drive sheets that you can then link into other examples. And what we are hoping to do with the toolkit is we've created a resource hub where you can look that we've put external resources for providers, for youth. And then what we're asking for is that folks who utilize the toolkit also upload things to the hub. So especially the experiences that you're having, the changes that you've made, what works, what doesn't work, so that this can continue to be an iterative process where we're all contributing, where the experiences of the young people that we work with are being brought to the rest of the folks who are working with young people so that we can do a better job and really do meet their needs more effectively. So with that, we want to thank you. You can see the toolkit, actually, I think it's in the resources section here at the conference, but you can also download it at this website here. And I think, let me see, do we have time? Yeah, I just want to, for a second, pardon me while I try to do this correctly. I want to just show you, if I can find it, the toolkit itself. So you've seen lots of sheets from it now, but I just wanted to kind of show you how it works. So this is a study module, and you can see that in this section, there is, for example, explaining confidentiality in plain language. And if you click on it, then it takes you to the tip sheet. that explains how to explain confidentiality in plain language, and gives you some examples. So we've really tried to make it usable. We're very interested in feedback and participation, and we have a few minutes for questions. I don't know if there's a moderator on this call and if they have a way of.
Yeah, I just shared the toolkit in the chat, and then also
Great.
it's in the material in the Hoover app.
Yeah.
Oh, yeah, but I did just share it in the chat right now.
Thank you, Alexis, for being more tech savvy than I am. Okay, so I don't know if you all have the ability to unmute your microphones, and I'm not sure how they were dealing with questions. I suppose you could put your questions in the chat if anyone has questions, and we can respond to them there.
I can relay some of the questions from the Hoover also.
Oh, okay. If you could do that, that would be great. Thanks, Patrick. So any questions? Patrick, is there anything in the Hoover?
Yes, I have.
There we go. And here's one in the chat. So this says, not a question, but I'm interested if there are any healthcare providers here who work directly with youth who are in need of a medical assistant, intern, volunteer. Ah, this is something, this is, oh, I wish you were in San Francisco. I know people who need your services here, but this is just somebody who's networking here in the chat. So you might want to take a look at that.
Victoria Harder says, do you do provider trainings?
So pre-pandemic, we actually did a whole series of provider trainings for the Hub Clinic in LA. And I think that over the next year or so, depending on funding, we would like to start doing trainings again. We also had a plan to create, what are they called, like online learning experiences that covered some of the topics, but and so that's one possibility. That, so again, a deeper dive on each of these topics. But what we'd really love to do is do face-to-face trainings again, because they're really, I think, the most effective way to engage in behavior change. So keep an eye open on the RHEP website, and any training should be publicized there. I think also if you're in a system that would particularly want a training for your system, you could contact us through the website and we could look at what are the possibilities there as well. Anybody else? Well, I am sure you guys are all burned out from a big day at the conference. I hope that you enjoyed it. I hope that this will be a good resource for you. What aspects of this toolkit do you anticipate to change in the next 5 to 10 years, if at all? Probably everything. You know, the law changes, sexual and reproductive health approaches change. I think what won't change a whole lot is approaches. You know, those aspects of the interaction that are trauma responsive, and that really enhance agency are going to stay pretty much the same. But some of the nitty gritties around, you know, even what contraceptive options are available, certainly the, you know, in terms of pregnancy termination, things are changing all the time. So those things will change. You will be able to, in the toolkit, anything that is, you know, things that are based in the evidence or in best practice, the literature is cited, the resources are cited. And in some areas, for example, you know, STI treatment, rather than including it in the toolkit, because it changes so much, we just link to the CDC, which is the authoritative source on approaches. I hope that answers the question. But as we get feedback, there may be things that we really want to develop further based on the feedback that we get in the resource hub, or things we want to substitute in or take out or modify. So we're hoping to have this be a living document, and we'll be revising it on a regular basis. All right. Well, thank you so much for your time and attention today. I hope this was helpful, and I hope, if nothing else, it piqued your interest and you'll take a look at the toolkit and give us some feedback about it. We really want it to meet your needs and to have a true impact on the quality of care that's delivered for youth who are in foster care. So thank you very much.